Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience tuning in at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also, tuning in through our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. This is part of our News You Can Use segment here at WYAD, and today we're talking about lung cancer and lung cancer screenings. You may not realize this, but lung cancer is the nation's leading cancer killer, accounting for 25% of cancer deaths in the U.S. alone. But the good news is there are more screening options that are available than ever before to help detect lung cancer at its earliest stages, and that's what we're going to be talking about today with our guests. We're excited to welcome Dr. Timothy Mullett to our program. We're going to talk to him not only about what you need to know about who should be screened for lung cancer, but also where you guys can go for more information. Dr. Mullett, thank you so much for the time. Really appreciate it.
Thank you, Cyrus. It's nice to be here. Appreciate the opportunity to talk about a message of hope for lung cancer.
Well, I appreciate that. And this is an interesting topic, Dr. Mullett, because a lot of times people think, well, if I'm not a smoker, I don't have to think so much about lung cancer. But who is most at risk, Dr. Mullett, when it comes to developing lung cancer, and can non-smokers also get lung cancer?
And that's a great question, and I think that it is important to understand that there are some specific risk factors for lung cancer, and tobacco being the chief among them. There are other risk factors, though, such as radon exposure. We should know what our radon levels are in our homes. Heavy metal exposure, other environmental exposures, but chief among those is tobacco exposure. And so if you have a history of tobacco, you certainly should be talking to your doctor about quitting, or if you've already quit, even if you've already quit, talking to your doctor about the opportunity and whether you're eligible for lung cancer screening.
So with that being said, then, who should get screened for lung cancer then? When should it happen, Dr. Mullett?
Right. Lung cancer is certainly we should be screening patients. We think about 50 plus 15. So if you are over 50 years old and you have more than 15 years of exposure of tobacco, then you should be talking to your doctor about the possibility of lung cancer screening. You may be eligible for that, and even if you've quit smoking, you may still be eligible for lung cancer screening. Lung cancer screening can decrease the opportunity for you to be found with late-stage disease. We can find these cancers earlier. We can find them at a time when we can cure them. We can treat them with surgery. Many times just small incisions, a video camera or a surgical robot can be used, and patients tolerate this procedure very well. So I think that if you think that you may be at risk for lung cancer, if you have a tobacco history, if you're more than 50 years of age, talk to your doctor about lung cancer screening.
Well, doctors' visits are not something that most people look forward to, as we all know. But what advice would you give to our audience then about getting over their reluctance to be screened for lung cancer and to talk to their doctor about it?
Right. I think that there's certainly a fair amount of stigma associated with the diagnosis of lung cancer. You may know people in your family, or you may have friends or colleagues that have had this disease. And if we think about the way that it was treated years ago, we didn't have as much effectiveness as we do today. So I think the message is that it's not your grandfather's lung cancer. It's actually, we have much more effective treatments. And so you need to go into this with an expectation that we can have better outcomes than you've seen before. Our treatments are moving forward with much more targeted therapy, more opportunities for having more effective therapy, even if it's found later than early-stage disease. And so our outcomes are improving, and if we can increase the access and utilization of lung cancer screening, we'll have even more of an impact. Right now, only about 10 to 15% of those people that are eligible for screening are actually getting this done. And so I think that it's a message we want to make sure that both the public as well as the providers are aware of, that we want to increase lung cancer screening to try and capture as many people as possible.
Such a great point. And I'm so glad we have you, Dr. Mullett, here to be able to talk to our audience about this. So where can our audience go for more information?
Well, I think that certainly it's important to talk to your doctor about it, but if you want to look for more information, you can look at the American College of Surgeons website, www.facs.org. I think the message is that anyone with lungs can get lung cancer. There are people that are at high risk, and we certainly want those people to be screened, but we want to make sure that we are increasing awareness about risk factors such as tobacco exposure, trying to help people quit, and there are new ways to be able to help people with that. Radon exposure, decreasing your chance of radon exposure that can decrease your development of lung cancer, even if you're a non-smoker. And more importantly, lung cancer screening is easy. It's a CT scan, no needles, no injections. Just takes about 15 seconds to lay down and go through the scanner, and it can save your life. And so I think this is something that can be done every year. And again, talk to your doctor or go to that website.
Very important information. Again, everyone, Dr. Timothy Mullett has been our guest here. Dr. Mullett, again, thank you so much for the great work you're doing and for the time today. Really do appreciate it.
Thank you, Cyrus. It's a privilege to talk to you.
And we thank your audience for tuning in to another great segment of Conversations Live, powered by News You Can Use segment here at WYAD. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.